Today I'm talking about the typhoid. Typhoid is a bacterial infection that can lead to a high fever, diarrhea and vomiting. It can be fatal. It is caused by the bacteria Salmonella. This shapes the bacteria Salmonella. The infection is often passed on through contaminated food and drinking water, and it is more prevalent in places where hand washing is less frequent. It can also be passed on by carriers who do not know they carry the bacteria. This diagram illustrates the typhoid infection. Contaminated food and drinks into fecal-oral route into gallbladder, carrier intestine, shed-in feces. The bacterium lives in the intestines and the bloodstream of humans. No animals carry this disease, so transmission is always human to human. Salmonella typhi enters through the mouth and spends 1 to 3 weeks in the intestine. After this, it makes its way through the intestinal wall and into the bloodstream. Symptoms. Symptoms normally begin between 6 and 30 days after exposure to the bacteria. The two major symptoms of typhoid are fever and rash. The rash, which does not affect every patient, consists of rose-colored spots, particularly on the neck and abdomen. Another symptoms: high temperature fever, severe headache, nausea, stomach pain, loss of appetite, constipation or diarrhea, rash. Diagnosis. A diagnosis of typhoid fever can usually be confirmed by analyzing samples of blood, stools or urine. This will be examined under a microscope for the Salmonella typhi, bacteria that cause the condition. The bacteria aren't always detected the first time, so you may need to have a series of tests. Testing a sample of bone marrow is a more accurate way of diagnosing typhoid fever, but getting the sample is both time-consuming and painful, so it's usually only used if other tests are inconclusive. If typhoid fever is confirmed, other members of your household may also need to be tested in case you have passed the infection on to them. This picture illustrates the typhoid analyzing. Treatment. The only effective treatment for typhoid is antibiotics. The most commonly used are ciprofloxacin and ceftriaxone. It is important to rehydrate by drinking adequate water. The two main vaccines available to prevent typhoid fever are VI vaccine given as a single injection, TY21A vaccine given as 3 capsules to take on alternate days. Avoiding infection. Make sure to wash your hands well. Drink sterile water. Be careful not to eat anything that has been eaten. Avoid eating at street food stalls and only eat food that is still hot. Avoid fruits and vegetables without washing. Goodbye.